Hello everyone and welcome to Know Your Drug, powered by MediInsights, the ultimate destination for all things of health and wellness from the fascinating world of medicals and pharmaceutical. We are here to guide you on lactulose solution, exploring the various aspects of lactulose, their usage, dosage, mechanism of action, side effects, and most importantly, essential advice for taking them safely and responsibly. Before we begin, let me emphasize that the content provided in this channel is purely educational. Always consult a healthcare professional for personalized advice regarding medications. Now, let's get started. Lactulose solution is a commonly prescribed medication used primarily to treat constipation and hepatic encephalopathy, a complication of liver disease. It works by drawing water into the colon, softening stools, and promoting bowel movements. Here are the detailed aspects of lactulose solution. Starting from use of lactulose solution. Lactulose solution is used for two main purposes. It is utilized to relieve constipation by softening stools and increasing the frequency of bowel movements. It is particularly beneficial for individuals suffering from chronic constipation or those needing to avoid straining during bowel movements. Lactulose is also prescribed for hepatic encephalopathy, a complication of liver disease where toxins build up in the bloodstream and affect brain function. Lactulose works by reducing the absorption of ammonia in the colon, thereby lowering ammonia levels in the blood and alleviating symptoms of confusion, disorientation, and lethargy associated with hepatic encephalopathy. Next, discuss dosage of lactulose solution. The dosage of lactulose solution varies depending on the condition being treated and the individual's response to the medication. Let's discuss the dosages. For constipation, the usual starting dose for adults is 15 to 30 milliliters once daily. The dosage can be adjusted based on the response, up to a maximum of 60 milliliters per day. For children, the dosage is determined based on weight and is usually lower than that for adults. The dosage for hepatic encephalopathy is higher and is typically titrated to produce 2 to 3 soft stools per day. Adults may initially take 30 to 45 milliliters 3 to 4 times daily, with adjustments made based on response and ammonia levels in the blood. It's crucial to follow the dosage instructions provided by the healthcare provider or as indicated on the medication label. Using more than the prescribed amount can lead to diarrhea and dehydration. Next, discuss mechanism of action of lactulose solution. Lactulose solution exerts its effects through several mechanisms. Lactulose is a non-absorbable sugar that draws water into the colon, softening stools and increasing their bulk, which facilitates bowel movements. In hepatic encephalopathy, lactulose alters the colonic pH, promoting the conversion of ammonia to ammonium, which is less readily absorbed into the bloodstream. This reduces the levels of ammonia circulating in the blood, thereby alleviating symptoms of hepatic encephalopathy. Next, discuss side effects of lactulose solution. While lactulose is generally considered safe, some individuals may experience side effects. The most common side effect of lactulose is diarrhea, particularly with higher doses. This occurs due to the osmotic effect of lactulose drawing excess water into the colon. Some people may experience abdominal discomfort or cramping, especially when initiating treatment or with higher doses. Lactulose fermentation in the colon can produce gas, leading to flatulence or bloating in some individuals. Prolonged or excessive use of lactulose can lead to electrolyte imbalances, particularly potassium depletion, due to increased stool output. Severe or prolonged diarrhea can result in dehydration, especially in vulnerable populations such as the elderly or those with pre-existing medical conditions. Next, discuss important advice for taking lactulose solution. When taking lactulose solution, it's essential to adhere to the following advice. Ensure an adequate intake of fluids to prevent dehydration, especially if experiencing diarrhea. Pay attention to the frequency and consistency of bowel movements. Adjust the dosage as necessary to achieve the desired effect without causing discomfort. If starting lactulose treatment, begin with a lower dose and gradually increase as tolerated to minimize the risk of side effects. Always follow the dosage and administration instructions provided by your healthcare provider or as indicated on the medication label. If experiencing severe or persistent side effects, or if there is no improvement in symptoms, consult a healthcare provider for further evaluation and management. In conclusion, lactulose solution is a valuable medication used for the management of constipation and hepatic encephalopathy. Understanding its proper use, dosage, mechanism of action, potential side effects, and important advice for taking it can help ensure its safe and effective utilization in clinical practice. By the end of this video, you'll have a solid understanding of the use, dosage, mechanism of action, side effects, and important advice for taking lactulose. Remember, knowledge is power, and being well informed empowers you to make the best decisions for your health.